Thanks, Solange. Can I just double check if you can see my screen?
I can.
Thank you. So I will take you through the session, and what I propose we do is that we cover the whole session on identifying and refining questions for systematic reviews, and then we leave all the questions for when we finish with the session. So we'll take questions at the end. And just another request is that if anybody is experiencing any technical difficulties, if they can please just either drop Solange an email or add a post in the chat function. So in the session that we're covering today, we have a few learning outcomes for the session. And really the objectives is that by the end of the session, participants will be able to understand how to define and importantly further refine questions for systematic reviews, that you'll be able to understand the use of scoping the steps to register a title for a new systematic review with Cochrane, and I will talk you through a little bit more around Cochrane review groups and the process to follow. So I think it's important before we embark on the whole session around defining questions for review, just to remind ourselves what a systematic review is. And I'm sharing with you the definition from Moa et al., where they put forward that a systematic review is a review in which bias has been reduced by systematically identifying, then appraising, synthesizing, and if relevant, also including statistical aggregation of all relevant studies on a specific topic according to a predetermined and explicit method. And what this definition implies is that when you're conducting a systematic review, you do it for a specific question that you need to have answered, that you then have a protocol for that systematic review, and that you conduct the review following that protocol. And our session today is really on that very important first step, which is around phrasing a question for a systematic review. So another way of considering this is to just think through the various stages in conducting a systematic review. And from this flow diagram, you can see step one is to formulate your question. Then that will inform and you can move on to develop a protocol for the review. And then there's the various stages of conducting the review and ending off with the communication of the findings of the systematic review. So where does one start in phrasing a review question? And this is not a light bulb moment. It's not something that happens in a few minutes or even a few hours. It is something that is a process and that you need to allow time to be able to phrase a clear review question. Importantly, when you start identifying proposed topics and scopes for systematic reviews, you need to consider important and relevant questions. You need to have your finger on the pulse around issues linked to burden of disease, key challenges that's facing communities or patients that you are working with, issues that stakeholders such as policymakers and consumer groups are grappling with. So importantly, you want to identify a topic that is of interest and of relevance, so that through the answers of your systematic review, you can inform both public health and clinical decision making. And typically, when you're conducting a systematic review, you are not focusing it just on a national or local level, but you're considering an international perspective when you're thinking through the question for your systematic review. Now, the reason why it's important to focus on having a clearly formulated question is that this particular first step then informs all the subsequent steps. It informs how you're going to identify studies. It informs how you're going to be selecting studies for inclusion, and all the subsequent steps linked to data management, data analysis, and even how you end up structuring the results findings of your systematic review. So let's look at the question. And as we know, chronic diseases of lifestyle is rapidly increasing, and we're dealing with huge burdens of disease linked to hypertension, amongst others. So this question is linked to a recently updated Cochrane systematic review, where the overarching question is, what are the effects of beta blockers, which is a certain drug treatment, compared to placebo, no treatment, or another antihypertensive drug, on mortality and morbidity endpoints in adults with hypertension? So we're going to unpack this question as we move forward. Importantly, when you are phrasing your question, the approach that you can use to unpack and make sure that you clearly define your question is what's referred to as the PICO approach. And in this acronym, the P is your prompt to identify who it is that you're dealing with. So who's the population of interest? The I in terms of what is the intervention of interest? The C is where you consider what you're comparing that intervention to. And the O is where you are thinking through the various outcomes linked to the intervention that's being assessed. So if we take this one at a time, so let's start with the P for participants. So here we want to be clear on what is the condition of interest. In some cases, you can include explicit diagnostic criteria, and you may want to include identifiers such as, is this a hospital-based or community-based, or is it a certain age group, is it adults or children? And if we come back to our example, in the question that I've shared with you, the key participants or population group would be the adults with hypertension. If we move on to consider the interventions, this is where you want to be clear around what the intervention is, and you can even go further to unpacking what is the mode of delivery, what is the dosage and intensity that you're interested in, or the duration of treatment, or if there's some co-interventions that needs to be considered. This is also where you can unpack it when you talk about the I in PICO. And if we go back to our question that we're using as an example, in this case, there's a specific drug that's being considered, and it's beta blockers. When these authors unpack their protocol, they will add more details linked to beta blockers and dosage and timing and mode of use. In terms of comparisons, this is where you need to clarify, are you comparing it to no treatment, or placebo, or standard treatment, or maybe to another active treatment? And in the example that we're looking at, they put forward that they're comparing it to a placebo, no treatment, or another antihypertensive drug. Lastly, in terms of PICO, we get to the O, which is where we talk about and consider the type of outcomes. And here you can identify the key or the most important outcome, which is often referred to as the primary outcome. And you can have further secondary outcomes that you're considering, which can also include key safety outcomes. And when you think through the outcomes, you do not just want to think of it in a research perspective, but you actually want to get a sense of what are the important outcomes for the recipients of this particular intervention. So if you think of consumers and also the providers of care, which outcomes are important to them? In the question that we're using as an example, they included both mortality outcomes, and that was their primary outcome. And then they also look at various morbidity outcomes, which included aspects such as having a stroke or having a heart attack. So in phrasing the question, for instance, one can, instead of saying morbidity, we could say on having a heart attack or a stroke and death in adults with hypertension. So you can unpack morbidity further, or use it in the way they phrase this particular question. So you can see how the use of PICO can guide unpacking the question. And what we often find is if you are starting to formulate the question for review, it's good to not start trying to write the question in a question format, but to actually start by identifying the PICO elements first. And once you've clarified that, it's a whole lot easier to then actually structure your proposed research question for a systematic review. So I have focused on using PICO and illustrating PICO to you using what is called an intervention question, which means we're looking at a certain treatment strategy. But you can also use PICO for other types of questions. So in the clinical setting, you may have questions around diagnosis, or you may have questions around risk factors, and you get various other types of questions, and you can use this approach to also phrase those other types of questions. And I think the best thing and advice for everybody that's grappling with research questions is to actually start using the PICO approach for the questions that they are busy phrasing. Another big debate, which you'll come across when you read the Cochrane handbook, is this whole issue around if you're phrasing a question for systematic review, should it be a broad question or a narrow question? And this table provides you with an overview of some of the advantages and disadvantages of having a broad compared to a narrow question. So an example of a narrow question would be like the one that we've just looked at in terms of beta blockers as a specific intervention compared to placebo or no treatment or standard treatment. It's quite easy to write and easy to read. But if it is that busy decision makers are looking at treatments for hypertension, they will have to read multiple reviews looking at different other strategies for treating hypertension. And so the one review on a narrow question is not going to give all the answers. If one goes with a broader question, such as maybe looking at various treatment strategies for a particular condition in one review, that review will be more comprehensive and more generalizable, but the disadvantage is that it will become quite complex. For example, I've been involved with a review that looked at both the prevention and management of treatment strategies for oral candida in people who are HIV positive. And in that particular review, it looked at all different treatment strategies or all different preventative strategies with open comparisons. And the key narrowing factor was really around that the population had to be HIV positive and they had to be diagnosed with oral candida or at risk of developing it. So that was one of those very broad and complex reviews, and it was actually quite difficult to structure the review when it got to actually writing up the review. So this is another consideration to keep in mind as you unpack and consider your own question for a systematic review. So we're at the stage where you may have been talking to people, you have identified a proposed question for systematic review, and you have started to phrase your question using the PICO approach. The most important next step, which is not to now start developing your protocol for your review, but it's actually to start reading existing research and existing systematic reviews which are related to your question. This is a quote from the Cochrane handbook, which I think is really summing it up really nicely. And what it says is that a well-formulated review question usually doesn't appear out of thin air. It occurs in the context of an already formed body of knowledge. And therefore, it's important for you as the proposed person who will be conducting a review to be reading around the topic itself, and importantly, to identify existing systematic reviews that may be out there on the question that you want to have answered. So the one of the things that many people have started doing before embarking on a systematic review is actually to conduct what is called a scoping review. And there's some very good reading that I'll recommend to everyone on this webinar. It's a paper on the typology of reviews, and it contrasts various types of reviews. And one of the key things as a feature of a scoping review is that it provides a preliminary assessment of the potential size and scope of available research literature. And it really is very useful to inform new research agendas, and also very useful for informing new systematic reviews. The next slide is just giving you a little bit of a summary of typically if you're doing a scoping review, how do you go about doing it? And in terms of the search for scoping review, you don't try to do the extensive comprehensive search that you'll get with a systematic review, but you're mainly aiming to do an assessment of what is out there, both in terms of ongoing research and completed research. Usually you don't spend a lot of time in terms of assessing the quality of what you find, but you try to synthesize the findings mainly descriptively. So you'll use tables, and you'll try to look at the characteristics of how much is out there, what kind of study designs have been done to answer features of the question that you're interested in, and also some other key descriptive elements. But at the heart of this whole approach is for you to be reading existing systematic reviews and protocols. So whether you want to do a formal scoping review, or whether you just want to do a search in the Cochrane library or on Medline to look at existing reviews, you cannot skip the step of looking for systematic reviews. The Cochrane library has a wealth of information. There are two databases, the Cochrane database of systematic reviews, and also the database of abstracts of reviews of effects. And both of these will provide you with key reviews that both have been done by Cochrane and also by non-Cochrane review authors. In terms of the Cochrane database of systematic reviews, you also access protocols of systematic reviews which are ongoing. So an essential step after you have your preliminary PICO question is to go and search the Cochrane library to identify any existing reviews that you can find related to your topic. We also encourage that you go and see if there are any ongoing or other ongoing systematic reviews. And there is the Prospero register, which is an international register of systematic review titles. So sometimes people start embarking on systematic reviews, and even before they get to have a formal published protocol, they will register the title on Prospero, and this is a searchable database where you can identify key aspects such as PICO elements ongoing. So when you then review, unpack these reviews, and there are various tools you in authoring majority of these existing the tool can be used for systematic review both randomized as well as non-randomized linked to healthcare interventions. So it's about a 16-item tool that you need to go through and answer key questions around how well an existing review was conducted. So it provides you with a good guide to critically appraise that review. But importantly, you need to interpret the findings of these existing reviews. Aligned with your PICO question that you're interested in, you should be able to look at these existing reviews, and you'll often find more than one existing review on the topic. You need to unpack which interventions were assessed, what were these compared to, in which populations were they being evaluated, which outcomes did the systematic review authors look at, and the studies that they included, which outcomes were reported, what was then the effects of the interventions that were being assessed, and then most importantly, did these reviews identify a gap in the evidence base? Because what you can do is to then pick up on the gaps that's been identified to inform any further new reviews that's being embarked on. So I think the most pressing question when you're looking at these existing reviews would be, what are the implications of these existing reviews on your own review question? Just in brief, what many authors of reviews and also those who are accessing and assessing existing systematic reviews have started doing is to do what's called evidence mapping. And this can be done in the pre-stage before you embark on a systematic review, where you actually assess, based on these existing systematic reviews, what do we know about the effects of interventions on particular outcomes? Where do we have enough to inform policy? And where are there gaps? And those gaps then inform future research that needs to be conducted in terms of future systematic reviews. So that's at the pre-conduct of new systematic reviews, where you can use evidence mapping to identify the gaps so that we can minimize waste in terms of our own time and resources to not unnecessarily duplicate existing systematic reviews. Another level where evidence mapping is also used is when you actually are conducting a systematic review, and then you can also have a clear map of the evidence in terms of what you have found. So in this slide, I'm showing you a useful paper that actually will provide more detail around what the evidence map is all about. It covers different definitions, methods, and products linked to evidence mapping. So in summary, the key thing to consider is that you will start off with an initial review question, which you will have identified linked to burden of disease, your level of interest, the engagement with various stakeholders. But then importantly, you will take stock of existing reviews and existing research to then help you refine your initial review question. And this is often not this kind of straight line, which I'm illustrating and using on the slide. It can be an iterative process that takes a bit of time to come up with a new, succinctly defined and very relevant new review question. Just a short advert for those of you who want to build your own capacity to be able to identify, critically appraise, interpret, and consider the use of systematic reviews. We have an online short course that will actually be running from April to June that equips participants with the knowledge and skills to find, appraise, interpret, and apply the findings of systematic reviews. So what next? So you've unpacked your question and you feel that you have a novel new topic and you want to embark on a systematic review. And if you're interested in conducting a Cochrane review, the first step that you need to do to initiate the process is to formally register the title for that systematic review with a Cochrane review group. The importance of registering your title is to prevent duplication of effort with other authors working on Cochrane reviews, and to make sure that your topic is appropriate for the conduct of a Cochrane review. So a Cochrane review is a systematic review that is produced by Cochrane. It follows a standardized format. Following title registration, you need to develop a protocol, and that protocol is then peer reviewed, and once it's finalized, it will be published on the Cochrane library. You then conduct the systematic review, and when it's completed, again, it will be peer reviewed, and once it's finalized, the final review will also be published on the Cochrane library, and it will be indexed on Medline. The other aspect that makes Cochrane reviews different from many other systematic reviews is that there's an open process for inviting comments and criticisms on even completed systematic reviews. And there's also a process for keeping reviews up to date. So one of the primary motivations behind the conduct of Cochrane reviews is to provide a rigorous and a robust summary of the evidence to help people make well-informed healthcare decisions. So Cochrane reviews are conducted on effective interventions. There's diagnostic test accuracy. There's also qualitative synthesis that's being done. But importantly, the motivation for Cochrane reviews are to resolve conflicting evidence, to support healthcare policies and practices, and identify the need for future primary research, future trials or controlled before-after studies, depending on the question. So future research that needs to be done. So where does one start? I've outlined to you in brief the steps in doing a Cochrane review. And before you can get to registering the title, you need to clearly define your question, and you need to have a rationale or reason of why your question is important to be done. Cochrane has various what's called Cochrane review groups. One can think of it as mini journals. Each of the Cochrane review group has an editorial base, which basically manages the whole process and provide editorial support for review conduct. And there's more than 50 Cochrane review groups that are organized thematically. For instance, you get the Cochrane Back group, you get the Cochrane Infectious Diseases group, you get the Cochrane Heart group, and they will really be doing reviews linked to that thematic area. Before you even get to doing title registration, if you know which thematic area you're interested in, the first step from our side is that you go and check the review group's website. And on the review group's website, you can find a wealth of information. I've just sharing with you some screenshots of some of the review groups. So for instance, the one up now is on the Cochrane Public Health Group site. And on this website, you will find links to the existing review portfolio, both protocols and reviews. You will find more information about the review group, and you'll also have access to useful resources for consumers and also for other authors. Importantly, some of the review groups also have topics available that they are working on. The last screenshot that I'm sharing with you here is the screenshot from the Cochrane Effective Practice and Organization of Care group. And importantly, they actually have a priority list of topics that gets regularly updated. So on their website, which was actually updated this month, there is an updated list of priority topics for reviews. So checking the relevant review group website is a good place to go and start looking. Some cases, the review groups decide that they're not taking on new titles for a specific period of time, and that they will also have on their website. If you then register your title, there's a few things that needs to be done to register it. By this time, you should have checked that based on what you can find, your title and your question has not been answered by other systematic reviews. When you submit the formal title registration form, which is usually available on the review group's website, the review group will also check to see if there are any existing reviews on that topic or if there's anything ongoing in another Cochrane review group. Another important step is that as part of your title registration, you need to already put forward who is the review team who's going to be working with you in conducting this review. So in order to conduct a review, it's not one person doing it, it's a team of people doing it, who work together. There are key methodological aspects in conducting a Cochrane review where you need to be 2 people as a minimum working independently to, for instance, select studies for inclusion or assess the risk of bias of included studies, or be doing data extraction independently and then comparing. So as part of title registration, you do not only put forward your proposed review question and your rationale for doing the review, but you also need to put forward your review team and the roles that each of the team members will be playing. So you, as part of this process, by now need to know which review group you're registering with. You can, on their website, find the title registration form, and then importantly, you will contact the Cochrane review group via email, and then submit your title registration form. And it takes a few weeks for them to come back to you to either confirm that they will register your title or to come back to say that they may not be accepting your title for review. So in this session, the aim was to cover a number of aspects with you, to understand how to refine your questions for systematic review, and we introduced you to the approach of using a PICO approach to phrasing your question, for you to be able to understand the use of existing systematic reviews to help you to unpack your question and really identify a true gap. And if you've identified that true gap and you're interested in doing a Cochrane review, to go through the steps of how to actually register a title with Cochrane. Just at the end, I just wanted to share with you 2 important resources. The Cochrane Handbook for Systematic Reviews includes a dedicated chapter on phrasing your question for systematic review. And this book is browsable for free online. And then as part of Cochrane's open learning material, there's also a dedicated module on the introduction to conducting a systematic review. And as part of that module, there's a component on framing review questions. So at that point, I will pause, and we now have opportunity to take any questions or points for clarification.
Thank you so much, Taryn, for that wonderful presentation. So to all the participants, if you have a question, you can either speak or you can type a question in the chat box.
Good afternoon. Can you hear me?
Yes.
Okay. Thank you very much, Taryn, for a very useful presentation. I have two questions. The first one is whether or not you'll be sharing the slides with us. And then the second one is about scoping reviews. When you presented, the connection was not so clear, so you were breaking up and we didn't hear so clearly the information about scoping reviews. How formal is that process before doing conducting a formal Cochrane review? That wasn't clear to me. How formal is the scoping review? Maybe you can help us with that.
Okay, so Shalon, shall I respond? Yes, thank you. I did hear you clearly.
Yeah.
So Eileen, yes, we will share the slides with you. Solange mentioned that the recorded webinar will also be available on the Cochrane Centre's website. Secondly, when you identify a question for your review, the key aspect is for you to examine and understand evidence from existing systematic reviews and to be able to show how that then further refines your own question. The author teams are using different approaches. From Cochrane's side, there's no specification that you need to do a formal scoping review to actually then move into a Cochrane systematic review. But there is an important aspect as part of your rationale for doing a Cochrane review that you must show that you've looked for existing reviews and are aware of any existing reviews. So there's no requirement that you have to actually conduct a formal scoping review.
Okay. All right. Thank you very much for that. That's clear.
Thanks, Eileen, for the question. Anybody else? More questions? Okay, so it doesn't seem that there are more questions for Taryn. So I think we've come to the end of the webinar.
Hello.
Oh,
hello.
Elizabeth?
Can you hear me?
Yes.
I was just typing a question because the sound quality was poor, but let me just quickly put it across.
Okay.
The Prospero website, is it accessible to all, or do you need special access? Because I understand that that's one of the recommended websites that you check before embarking on a Cochrane's systematic review. So do you need like a registration, like an access code, or can you just type in Prospero and access the list directly?
Hi, as far as I know, it is completely open access and that you don't need any registration to be able to access it.
Oh, okay. Thank you.
I just wanted to add that if you want to register a title with Prospero, if you're not doing a Cochrane systematic review, you do need to have a login. But this doesn't imply any payment or any subscription. You just create a profile so that you can log in and out of the system.
Okay, thank you. But if I'm doing a systematic review with Cochrane, will it automatically be registered on Prospero?
I think there is a joint agreement between Prospero and Cochrane on review registration. Am I right, Taryn?
Solange, so the way I understand the process is when your Cochrane protocol gets published, it's automatically then pulled into Prospero as an ongoing systematic review.
So much. That will be all from my side. Thank you.
Thanks, Elizabeth. Okay. So if there are no, Eileen.
Sorry, I have a question, please.
Yeah, sure.
Hi, my name is Deve. So I don't know, it might be that maybe I don't quite understand the purpose of systematic reviews compared to other types of reviews. But when I look at the PICO thing to help formulate a research question, I get stuck a bit on the intervention, the focus on intervention and comparison group. So it seems as though one would be looking at papers that are reporting on findings on intervention. Is that the case? Or because otherwise it becomes difficult to formulate a question when one is looking at these, what you call it? You know, like in accordance to the PICO issue. So I'm just wondering whether one could, does this mean that one would be looking at intervention type of studies for a systematic review, or can one do a systematic review for other types of studies as well?
So thanks for your question. One can do a systematic review on any question that you have. So if you think of healthcare, you may have a question around what's the best treatment. You may have a question around what's the best preventative strategy to use. You may have a question around what is the best health system arrangement to manage a particular condition. You may have a question around what is the best diagnostic test to be considering. You may have questions around what are risk factors that's associated with a particular condition. You may have questions around the experiences that people may have in living with a particular condition, which is more qualitative type of question. And for all these questions, you can do systematic reviews. The PICO approach is purely a guide to use to phrase a particular question. In the presentation, my focus was on an intervention type of question, with the intervention as in a treatment intervention, but you can use PICO to guide you to phrasing diagnostic questions, to phrase risk factor questions. And in those cases, you will just not for the eye use it for intervention, but it will be the issue of interest that you are thinking through. Secondly, I strongly encourage, and I'll just quickly share my screen again with all of you. I encourage you to read the paper on the typology of reviews, which will give you the analysis of the review types and their associated methodologies. This paper includes a very useful table that I'm scrolling through now, where they actually shows the type of review, a description of the review, and then key methods in how that review is then being done. So I really recommend that you have a look at this paper to help you orientate through the different types of reviews, which are all secondary research. So for instance, in this table, you can see there's a review, there's mapping reviews, there's overviews of reviews, qualitative systematic reviews, rapid reviews, scoping reviews, an endless list of the types of reviews that's out there, their key description and methods used within these.
Okay, thank you very much.
Thank you, everyone. We've come to the end of the webinar. Thanks for participating. Thank you, Taryn, again for the lovely presentation. And I hope to see you here next month for our next session, which will be on trial registration. Thank you, everybody.
Thank you.
Thank
Thanks.
you.
Bye.
Bye.